All right, we're starting this video by staging an intervention because I am 99.9% sure that the reason you're here is that you have been Googling your suspicious GI symptoms to try and figure out if you have something that maybe falls along the lines of irritable bowel syndrome, IBS, as opposed to something that might be more like inflammatory bowel disease, IBD. And I know this because this is exactly what I do. I am the worst about self-diagnosis a la WebMD out of anyone out there, and I have taken my career in health education and research as a means to take that game to a whole new level. So this is the pot calling the kettle black. But if you are on the fence about what's going on and you don't know what's up, pause this video, call your physician, set up an appointment, because you're just not going to know until you've had that appointment with your physician. Because when it comes to different GI disorders, they all can have these overlapping symptoms, and it's really hard to distinguish what's going on based off of symptoms alone. So I'll hang here and wait while you go set that up. Come back to me when you're ready, and then we'll start talking about the differences between IBS and IBD. So let's talk about how IBS and IBD are classified, measured, and diagnosed. Now, both conditions are chronic gastrointestinal disorders, but they fall within very different disorder categories, you could say. So for IBS, it is defined as a condition of gut-brain interaction, but it falls within a classification of bowel disorders called functional bowel disorders. And functional bowel disorders like IBS are diagnosed using symptom criteria. They're also measured using various symptom measurement tools. So you're not using tests like blood tests, biopsies, and what have you to capture what's going on in IBS. It all comes down to symptoms. Now, when it comes to IBD, it's a group of what are called organic GI disorders. So organic GI disorders are a classification of disorders that result in structural changes in the GI tract. And IBD is characterized by measurable inflammation and structural changes of the intestinal tract as a result of that inflammation. So you can test for these structural or inflammatory changes with things like blood tests, stool tests, endoscopies, biopsies, and imaging studies. Now, you may have noticed that I said it's a group of disorders. So the most common forms of inflammatory bowel disease are ulcerative colitis and Crohn's disease. Ulcerative colitis is the type of IBD that's usually contained just to the colon, which is the last segment of the GI tract, whereas Crohn's disease is the type that can be found in patches of inflammation throughout the GI tract. Now, we've mentioned this whole idea of functional bowel disorders as opposed to organic GI conditions, functional being those which are measured by symptoms and no tests, whereas organic relate to things that you can capture with some sort of testing method, right? But these are general classifications, and the two categories can overlap to some extent. So, they're not neat and tidy within their own categories. For instance, there can be some organic features in people with IBS sometimes, on occasion, you might see increased inflammatory markers in individuals with IBS. So that would be sort of an organic biomarker, if you will. Whereas you also can see sort of these features of gut-brain interaction and inflammatory bowel disease, giving it sort of more of a functional component. For example, depression and anxiety are two major risk factors for IBS, but they also seem to play a role in the pathogenesis of IBD. So we have these disorders grouped into these two distinct categories, but I think it's important to know that there can be some gray area to contend with, and that neither disorder fits 100% into the functional or organic box all of the time. In fact, it may even be possible for the two conditions to co-occur, and that's something we're going to discuss more in just a bit. So the key takeaways here are that IBS and IBD are both chronic conditions. However, IBS is classified as a disorder of gut-brain interaction and is a functional bowel disorder that is measured with symptoms, whereas IBD is classified as a group of organic conditions like ulcerative colitis or Crohn's disease, and it's measured by test. But as I was saying, this whole classification system of organic versus functional does have some gray area and overlap.
Before we continue, I want to quickly tell you about ibsprobiotics.org. So this started out as a research project, but then we ended up turning it into this really cool comparison tool. When you go on the site, you can easily compare which probiotics were most effective for different IBS symptoms, all exclusively based off of clinical studies. In fact, we spent the past 2 years building it, having analyzed over 50 different probiotics across more than 75 placebo-controlled trials. And the results surprised us. For example, we found that some really popular probiotics were nowhere near as effective as some lesser known options. And there were even some probiotics that seemed to do more harm than good. So I hope this free tool helps you to cut through the marketing hype and saves you a ton of time when evaluating a probiotic.
Now, when it comes to the prevalence of IBS and IBD, those prevalence numbers can be all over the map, so much so that we actually have a running joke here about the prevalence of IBS in particular, because we read so many different IBS-related studies over the past several years, and they all start out with the exact same definition of IBS, but then give very different prevalence data. And part of that is that there can be some variance from one region to the next when it comes to the prevalence of IBS, from one country to the next, for instance. And also, there have been different diagnostic criteria throughout the years. They've been updated. And so the changes to diagnostic criteria can also change prevalence data. So for IBS, what we've seen is that global prevalence seems to fall around 4 to 9%. But in the US, it's a little bit higher. It's more like 9 to 10% of the population having IBS. So pretty common. And then when it comes to IBD, you run into the same issues of there being some variance by region, but it's much less common. And the global prevalence seems to be at about 0.08% or about 85 cases per 100,000 people. However, again, in the US, it's higher. And we see those numbers at about 0.4 to 0.5% of the population, or around 464.5 cases per 100,000 people to be precise. So key takeaway here, IBS is common while IBD is generally less common. Now, the million-dollar question is what causes IBS and IBD? But I guess one thing that these two conditions have in common is that the cause for both is poorly understood. And it's likely some sort of combination of genetic, environmental, and immunological factors that are contributing to both IBS and IBD. So for IBD, it's suggested to be a result of uncontrolled immune responses to a certain trigger in people that seem to be genetically predisposed. And then for IBS, the dysfunction centers more around gut-brain interaction. And there are different risk factors for developing IBS, such as, physical and psychological stressors, things like depression and anxiety, or GI infections, for instance, as well as certain fixed traits like gender. That's just to name a few. So I think one distinguishing thing, though, is that while genetics may play a role in IBS to some extent, the genetic component in IBD is a lot stronger. So you definitely see a little bit more genetic predisposition for IBD. So the key takeaway is that the causes of both conditions are poorly understood and likely related to a combination of environmental, immunological, and genetic factors, with genetics playing a larger role in IBD. Now, this is the part of the video that all of you people out there that have been Googling your symptoms have been looking forward to, where we talk about the differences between IBS and IBD symptoms. And one thing I want to point out is that there's so much overlap on the IBS side of things that there's really not many symptoms that can occur in IBS that can't also happen in IBD. So those which can be shared traits are things like abdominal pain, altered bowel movements. Usually it's going to be diarrhea in IBD, whereas in IBS, you can have diarrhea or constipation, a mix of both. Also, feelings of urgency, nausea, bloating, and distension. Bloating and distension is a bit more common in IBS, though. Also, mood disorders like anxiety and depression, fatigue, or feelings of incomplete evacuation. Now, some features that you may see in IBD that you don't really see in IBS are going to be things like rectal bleeding or bloody stools, persistent daily diarrhea, nocturnal bowel movements, so those which are happening throughout the middle of the night. Nutritional deficiencies can also happen from intestinal damage. So, the absorptive surfaces of the intestines maybe aren't working as well. And so you can have issues like anemia, for instance. Also unexplained changes in appetite and weight loss, progressively severe symptoms, growth failure in children in particular with IBD, fistulas, fever, vomiting, and then some other extraintestinal symptoms like joint swelling, for instance. Now, if you're having some of these symptoms that are distinct of IBD, particularly some alarm symptoms like rectal bleeding or bloody stools, nocturnal bowel movements, unexplained weight loss, anemia, or fevers, then that is your indicator that you're likely not dealing with IBS and that you need to immediately schedule an appointment with your medical provider to rule out other conditions such as IBD, just to see what's going on. So be sure to touch base with your physician right away if you have that going on. But I think the key takeaway here is that the presence of alarm features is a key distinguishing feature that is possibly found in IBD, but not in IBS. Now, when it comes to the severity of health complications that can come about from each of these different diseases, IBS seems to greatly impair quality of life, but it's not tied to the development of any sort of life-threatening health complications. However, for IBD, it impairs quality of life, but can also increase risk for poor health outcomes, ranging in severity from nutrient deficiencies to increased risk of colon cancer and other life-threatening complications in severe cases. So the key takeaway is that in severe cases, IBD can result in life-threatening complications, whereas IBS does not. As for the treatment of IBS and IBD and also the goal of treatment, that can differ to some extent. Both IBS and IBD treatment strategies can include things like diet, lifestyle, and pharmacological therapies. However, IBD can also require surgical intervention in severe cases, which is not a treatment that's used in IBS. And then the goals of treatment differ for IBS and IBD as well. So in IBS, the primary aim is just to manage symptoms, whereas in IBD, the goal is to control and prevent debilitating inflammation and hopefully the resulting poor health consequences that come from that. Now, what if you have the worst of both worlds? Like, is it possible to have IBS and IBD at the same time? So there are quite a few people who seem to have IBD that may also have IBS, or at least IBS-like symptoms, even when their IBD is in remission. So this is sometimes referred to as IBD IBS, and the prevalence of IBS type symptoms in IBD varies depending on the study or the form of IBD, ulcerative colitis versus Crohn's disease, and the method of confirming IBD remission, which is just a period of time when the disease is not in its active state. But with these factors in mind, we've seen prevalence ranges for IBS symptoms in IBD during remission in the ballpark of 23.5 to 40% of people with IBD. So fairly high numbers. Now, it gets pretty tricky for the people who have IBD, but who also experience IBS-like symptoms during states of remission. Because if you inaccurately assign where your symptoms are coming from, then there could be some serious health consequences. So for example, if you wrongly assume the symptoms are being caused by IBS when there's really IBD inflammation going on, not only are you not going to probably get the right kind of treatment and symptom relief, but you could also be at risk for serious bowel damage and complications that may come along with that. But then on the other side, if you're taking IBD medications in the absence of inflammation during what's more like an IBS flare-up, then not only will you not get the proper treatment you need for symptom relief, but you're being put at undue risk for side effects from those medications. It's definitely not fun to be in that position, but the best thing you can do if you are someone with IBD who also has IBS-like features is to always discuss all of your signs and symptoms with your doctor and make sure to get all of the testing that's needed so that your physician can help to decide what the best course of treatment is for you from one GI symptom flare-up to the next. So the key takeaway is that it's possible for IBS symptoms to co-occur with IBD even when IBD is in remission, and that close monitoring by your physician in the presence of IBD IBS is going to be necessary to ensure that you're getting proper treatment. And that concludes this video on the differences between IBS and IBD. But otherwise, if you have any questions for us, let us know in the comment section below. And also feel free to share any of your experiences when it comes to sorting out what you had going on, whether it was IBS or IBD or maybe even both. We would love to hear what you have to say about it all.
Thanks for watching this video. And as a quick reminder, don't forget to check out ibsprobiotics.org. We're really proud of this research project turned comparison tool that we've made. And of course, it is free and publicly available. And if you want to keep up to date with the latest IBS research, you can follow me here. See you next time.